Hi there, we're Group 6, and we'll be discussing serotonin syndrome and its treatment using cyprohepidine. Serotonin is a neurotransmitter in the central nervous system that regulates mood, appetite, and sleep. Despite most serotonin conditions resulting from a lack of serotonin, there are also less common conditions arising from an excess of serotonin. Serotonin syndrome is a neurological condition where one has too much serotonin in their central nervous system, usually causing symptoms such as high blood pressure and heart rate, muscle rigidity, loss of coordination, high fever, and diarrhea. In more serious cases, it can lead to seizures, irregular heartbeat, unconsciousness, and even death. Serotonin syndrome is caused by taking overly high doses and/or multiple drugs that increase the amount of serotonin in your brain. These are commonly antidepressants, such as selective serotonin reuptake inhibitors and tricyclic antidepressants, which inhibit the reuptake of serotonin, as well as monoamine oxidase inhibitors, which inhibit the breakdown of serotonin. MDMA is also another commonly used drug that inhibits serotonin reuptake. There are few drugs available to treat serotonin syndrome and its symptoms. One available drug is cyprohepidine, a drug that was initially approved by the FDA as a histamine 1 blocker. Cyprohepidine has been since found to be a potent antagonist for the 5-HT2A receptor, decreasing the amount of serotonin that reaches the postsynaptic terminal. Cyprohepidine can be administered every 2 hours until serotonin levels in the central nervous system are reduced, such that symptoms cease. Due to the potency of cyprohepidine, in most cases, cessation of symptoms is achieved in only one dose. From a pharmacokinetic point of view, cyprohepidine is dosed orally, metabolized hepatically, and excreted renally. Side effects observed with the use of cyprohepidine include nausea, vomiting, diarrhea, weight gain, drowsiness, and anticholinergic symptoms such as dizziness, confusion, and hallucinations. Large-scale clinical trials assessing cyprohepidine in the treatment of serotonin syndrome are limited. However, in vivo models and a number of small-scale trials are available assessing cyprohepidine in serotonin syndrome on a case-by-case basis. A 2001 study found that, out of a selection of drugs, cyprohepidine was the most effective and most potent in relieving symptoms in rats with induced serotonin syndrome. Human trials, however, have provided mixed results, with a 4-patient trial in 2001 finding cyprohepidine to be the only effective at providing partial relief from the symptoms of serotonin syndrome, with patients requiring dosing every 8 hours for 4 to 14 days. This is in contrast to an earlier study on 5 female patients suffering from serotonin syndrome from a multi-drug overdose of serotonergic antidepressants. Following treatment with 8 mg of cyprohepidine, only 1 patient required an extra 4 mg of dosing to relieve tremors. While the curative effect of cyprohepidine remains unclear, the available evidence supports its use as either a first-line or adjunct therapy. As of current, there are already drugs on the market used to treat serotonin syndrome. However, their overall ineffectiveness leaves a gap in the market that can be filled with cyprohepidine. Diazepam, known as Valium, is a benzodiazepine used for a variety of conditions due to its calming effect, and can be used to relieve muscle stiffness and serotonin syndrome. However, it does not cure the patient. Chlorpromazine, on the contrary, prevents hypothermia and fatality while decreasing the amount of serotonin in the central nervous system. However, it is a less potent antagonist than cyprohepidine and cannot be used to treat patients with hypertension, limiting its clinical reach. Deaths due to MDMA overdoses at music festivals are becoming more and more prevalent, where, if the patient is known to be taking antidepressants, cyprohepidine would be a viable option for the treatment. Furthermore, although death isn't common in clinical scenarios, the symptoms can cause major discomfort.